everybody, it's Dr. Jerisa ER coming to you today with your tips for the ER trip. Tonight we're going to talk about when high blood pressure takes you, unfortunately, to the emergency room. And just to recap on the last video, it was great. Thank you. I'm so glad that it helped so many people. What I decided to do also, when we talked about, kids with fever on the last video, and I decided to go to the drugstore and really see, how much are thermometers, because for whatever reason, there's a restriction or a limitation with parents actually checking their kids' fever. And I realized that, they actually have thermometers that are, $4 up to $17, but even the $4 one was really good. So there's no reason to not check your kid's temperature. Remember, fever is 100.4. So moving on to today, blood pressure, hypertension. We all know someone that has hypertension. So I'm telling you, share this video. If you share this video, I promise you, you will save a life. Blood pressure, normal blood pressure is 120 over 80. We all know that. High blood pressure is greater than 140 over 90. Okay, a lot of times when it's documented on two separate occasions that your blood pressure is greater than 140 over 90, you are considered hypertensive, and you should be considering taking medication at that time. When it's been documented on two separate occasions that your blood pressure is greater than 140 over 90. High blood pressure. So patients with high blood pressure, they are the biggest non-compliant patient category of non-compliant patients. They do not want to take that blood pressure pill. They will find every reason to not take a blood pressure pill. They are in denial. It's like you check your blood pressure, it's 145 over 95. Check it again. Well, check it again. I don't check it in the other arm. Like, they are in denial. And it's unfortunate because high blood pressure can be or is one of the, if not the most, number one silent killer. And that's because you have patients who have high blood pressure, hypertension, and they don't know it. So when you have it documented greater than two occurrences, that it is greater than 140 over 90, your doctor should be recommending medication at that time. Now, I have seen patients, because like I said, high blood pressure patients, they do not want to take that pill. I have seen patients, I've treated patients, even young patients can get hypertension, that are able to change their lifestyle, change what they eat, exercise, do what they say that they're going to do, and they are able to avoid being on the pill. So it is possible. It is possible if you do what you say you're going to do. And also, when you do that, set a duration, set an expiration date, and hopefully your physician is monitoring you during this process. That, we're going to do this for 1 or 2 months, see what you're able to do and accomplish. And if you're able to control it, then yes, you can avoid high blood pressure medication. But if not, it's important for you to go ahead and be compliant and take the blood pressure pill. Why? Because hypertension is a silent killer. And unfortunately, the longer you have high blood pressure greater than 140 over 90, when you're walking around with, the 145 over 90, 95, and the 160 over 95, and for years and years and years, and you don't know it, what happens is your heart, it gets larger. Your heart, you get congestive heart failure. It gets larger. And although you think, I'm going to have this big heart and this is great, it's not big in that kind of way. All right. It's big, but it's weak. And so your heart has had to enlarge over these years, and it got bigger and bigger, but it wasn't able to pump. It's not pumping hard. It's weak. And that's not a good thing, because complications are congestive heart failure, kidney problem, stroke, eye problem, a lot of complications from walking around with hypertension and not knowing it. Okay, my husband did a workshop a couple months ago, very informative. It was a blessing to so many people at Shiloh and Palm Beach County. But what we saw is that randomly people had blood pressure, greater than 190, greater than 200, and they were walking around with it on a Saturday morning with this type of blood pressure and didn't know it. And some of the patients, some of the people were actually on blood pressure medication. And so they were obviously uncontrolled. And that's what we're going to talk about. I have to break this down into 3 videos. High blood pressure is such a extensive system or diagnosis that I don't want to lose you. I don't want it to be information overload. I like to keep the videos less than 5 to 10 minutes. And so the next video, we're going to talk about some of the symptoms that will bring you to the emergency room. Some of the things to look out for that could give you a warning sign that maybe your blood pressure is high and you should go to the emergency room. We're also going to talk about some of the myths involved with some of the medications and why hypertensive patients don't want to take medications. And we're also going to talk about even blood pressure monitors. So share this video, save a life. This is part 1 of when high blood pressure takes you to the ER. I'm Dr. Jerisa ER, and I will see you next time. In the meantime, stop by one of the drugstores and just walk in. I'm actually a collaborative physician at a franchise drugstore, and it's easy to get your blood pressure checked. Just walk in there and say, where in here can I get my blood pressure checked? And they will do it, and you will know your normal. Very important for you to know your normal, because actually your normal could be 90/60. And so if your normal is 90/60, then guess what? Your high might be 130/90, okay? So you should know your normal. So until the next video, get your blood pressure checked, and I will see you next time. Enjoy your evening.